good morning, good afternoon, good evening, good whatever time it is, wherever you are. Welcome to Living Truthfully, the podcast. How you doing? My name is Amani Maranga, and I'm very grateful that you're listening to me, you're listening to this podcast, and thank you for all the great feedback and all the messages of goodwill that you sent to me over the last podcast that I told you I'm unwell. Now, I promised you that I was going to talk to Dr. Ngare. So, Dr. Ngare is one of the doctors that took care of me during the time I had COVID. And I want to go straight into that conversation. So, allow me to just call Dr. Ngare. And we'll talk to him. He has some radical thinking about COVID and the treatment of COVID. So, allow me to just make the call.
Hello.
Hello, Dr. Wahome Ngare. How are you, sir?
I'm very well.
And let me also put it up front that Dr. Wahome is also, related to me. He's my uncle. And so, thank you so much for doing this, Daktari.
Yes, I'm karibu sana.
So, first and foremost, I want to talk about this video that, that even prompted me to call you. Mm-hmm. Because, you started a conversation, and the Catholic Doctors Association, the chairperson, also started a conversation around the treatment of COVID. And in this video, you say that, it's treatable. And most of the COVID deaths that we have experienced might not be necessary. Why? Explain to me,
yes,
what that thought process is.
Yes, well, you know that we started hearing about this disease late 2018.
Yes.
And by the time we were getting to March or thereabouts, it was already in the country.
Yes.
And very little was known about this disease other than it was respiratory, and it was causing difficulties in breathing, and it was killing people. Mm. And it was a very, very tough period for anybody in clinical practice, because we could see Europe and the challenges they were going through. We could see the suffering, and there was no treatment that was available or known at that point in time.
Yeah.
And being doctors, we were expected to basically still take care of patients, and we still needed to be available for our patients.
Yeah.
So it was a very difficult time. The government said we close hospitals, close clinics. If you're not in essential services, then you must go home and stay at home. Mm. Now, I happen to be a gynecologist, and the children refused to be locked down.
Yes.
They continued coming. They didn't care that there was COVID.
There was no lockdown in the wombs.
There's no lockdown in the womb. In fact, some of those activities created even more work.
Yes.
But so for us, we didn't close. We couldn't.
Yes.
It was totally impossible. We continued working, and the call of duty was very clear. Mm. Then we start hearing stories of doctors who have found effective treatment. Mm. People who are trying what is called repurposed drugs. So there was one field that was running with creating vaccines. There was another one that was trying to create new antiretroviral vaccine tablets.
Yeah.
Then there was another arm that was looking at what are called repurposed drugs. Mm-hmm. These are drugs that already exist, that have been found to be promising against viruses. Mm. And some of these were mainly from the SARS experience in 2003.
Yes, and that's allow me to just jump in there and say we had experience with SARS.
Yes.
SARS was the one that was bird flu, was it?
Yeah, I don't know whether I can't remember what name they had.
There was bird flu and there was swine flu.
Yes,
yes, and so yes. I mean, we already had some experience with some interesting viruses. That's what you're saying from a medical perspective.
Yes.
Yes.
Now, some as people are trying to look for treatment, because the SARS of 2003 had a very high death rate. It's actually the case fatality rate was about 11 to 12% compared to this one that is 1.75% or 2%.
Wow.
So the people had really looked to see, are there other drugs that can be used?
Yeah.
So we started hearing those stories, and one of the most interesting one was by a doctor called Zelenko, who is an American doctor, a GP practitioner, and he in the desperate state he was in, because in the US they were hit much earlier than us.
Yeah.
He then looked around and saw that in Asia, there was a doctor who had used an antibiotic called azithromycin together with hydrochloroquine. And then he found another one who had used zinc and hydrochloroquine. And all he did was he looked at the hydrochloroquine, it was common, and he created a combination of three. So hydrochloroquine, zinc, and azithromycin.
Yeah.
And he gave this to his patients, and he only gave it to, because they already had statistics, and majority of the people who are dying were over 65 with chronic diseases. He only gave his treatment to those who were either very sick, so if you are young and you had very strong symptoms, or if you are over the age of 65 and you had those other risk factors. And he was able to see very quickly, from just anecdotal observation, that when he put his patients on those treatments, they were not ending up in hospital.
Wow.
And those who did not take the medicine ended up being admitted.
Wow.
And he very quickly talked about this. He's the one who told President Trump about hydrochloroquine and that stuff.
Yes.
But then he didn't have sufficient data.
Yeah.
And of course, the whole world is saying, show us data, how can we believe you? You have just noticed this thing.
Yeah.
Which is a big mistake in an emergency. In an emergency, you take information like that, you try it yourself. If it works, you also say it is working. If it doesn't work, then we know it is not working. But you don't dismiss somebody, especially when the drugs they're using are not poisonous.
Yes.
So basically, he was the first one to say this, and he made it very clear that hydrochloroquine must be taken together with zinc.
Yes.
That if you take any one of them alone, then it's not useful. So that was the initial story. Now, remember, this is around March. We are starting to hear the stories here in May. Yeah?
Yes.
By the time it reached about June, he was able to do a retrospective study, look backwards 3 months, look at the patients he started on treatment up to that point in time.
Yeah.
And he was actually able to demonstrate that 85% of the people he put on the treatment did not go into hospital.
Wow.
They did not develop severe disease and they did not need admission. Then the scientific world said that whatever he's published is basically not in renowned medical journals, that it is not peer reviewed, and it took a group of doctors, I think from Germany, to help him put together his study into a protocol that could then be published.
Yeah.
And it was not until December that the final publication was actually put in peer reviewed journals.
Wow.
Now, the problem here is that we lost almost
6 months.
8 months.
Yeah.
Just because people would not believe a doctor who had nothing to gain by saying that treatment is available. Then in June, July, a group of doctors in Australia had looked at a drug that is called ivermectin, and ivermectin is basically used.
This is the deworming drug, eh?
Dawa ya minyoo.
Yeah.
Dawa ya minyoo. Yeah. And they had used it because it had been shown to be useful against SARS in 2003 and against other viruses previously. So really, it was just checking to see whether it would work against this one.
Yeah.
And they found it was very highly effective in the laboratory.
Wow.
And therefore, people started using it and treating. And very soon, a lot of papers were generated from all over the world to show that it is extremely, extremely effective in the treatment for this disease. And again, that was not taken seriously because it was not published. So from June, again, it was not until December that we had these drugs available. Now, you imagine I'm in that state. From March, I am working with patients. I'm going to work. I do not have treatment. The only way I can protect myself and my patients is wearing masks, social distancing.
Yeah.
And then you start hearing this very useful information, and then it is rubbish because there is no published data.
Yeah.
And we started using the medication, and slowly we were able to demonstrate that even for our own patients, it was very promising. And that's how that process started. So now, when you look for data, you find a lot of information on ivermectin. The data that is available on hydrochloroquine, of course, they did their studies without. First, they gave it very late.
Yeah.
After the chest symptoms had already occurred, which is not what was recommended.
Yeah.
And number two is that they gave it alone, or they gave the zinc alone.
Yeah. So
and
they
refused to give the combination.
Yes.
So obviously the science there is biased.
Yeah.
But in practice, we can see a lot of benefit, and we have used it very effectively.
So I'm wondering to myself,
yes,
why this conversation is not being had by every doctor. And the reason I'm saying this is because when I went to hospital, I was unwell. I had been unwell for 3 days actually. And I went in, and the doctor, advised that we test for COVID as to rule it out. Okay.
Yes.
So I tested for COVID, and the doctor wrote a prescription for some drugs before my tests is out, that I could go home with to manage the symptoms. Okay, so I was given a cough syrup. I was given, because I was coughing, I was given paracetamol for fever. I was given zinc. That's it. And then, the rest of the drugs I got were, I manage high blood pressure. So that's one of the reasons I was going to hospital. I was going to get a refill for my blood pressure medicine. So the next day, that was a Tuesday. So the next day in the morning, I wake up and I have, I get this email.
Yes.
And this email has my results.
Yes.
And I'm COVID positive.
Whoa. And
I also get the email comes with the Ministry of Health guidelines on home care, but the guidelines don't tell me what to take. They don't tell me. They don't give me medication. They just talk about isolation, the steps that someone should take if they're giving care to someone who has COVID, but no information that tells me what to do with this positive result.
With the positive result
that I've gotten. Now that I know I'm positive, I don't want to walk around and infect other people. But the hospital also, the doctors do not tell me how to treat it, Yes. And I had to find that information for myself. Which first I think, there's something very broken about that system, And thankfully now one of the people that I asked to, that I told I was positive. In fact, what happened is that everyone had interacted with the week before. I felt a responsibility to let them know that I have contracted COVID, so that they can check out for symptoms as well. And if they see those symptoms, then they know what to do: go get tested or start taking medication. So one of those people was Pastor Mureithi Wanjao, because I'd been with him on Saturday, just a Saturday before, when I started feeling ill. And he sent me this video now with your information. And that's when I called you. And, very quickly I was able to get this medication, You asked me what I had. You advised me to get the hydrochloroquine, the azithromycin. And before long, I was taking drugs and I was... getting better, I did have a few dark days, but I already knew that I was doing the right thing. The reason I'm giving this narrative is because I'm asking myself, why aren't these doctors, or why didn't that doctor tell me, in case you get a positive result, this is what you do? In case you get a negative result, then this is what could be happening. I didn't have that guidance. If it wasn't for you, I would have been completely lost. What is holding them back?
It's a difficult question, and I think it boils down to the independence of the medical practitioner. One of the things that happens in our medical training is that you leave medical school knowing that you hold all the essays. The patient, it's you who will guide the patient on what they will do. And based on your guidance, then they may get better, they may get worse.
Yeah.
And it's a huge responsibility.
Yes.
But then there is also a lot of regulatory issues where you have now other people coming in to advise and give guidance. Unfortunately, for some doctors, they forget that in the end, it is my personal decision that then makes the day or breaks it. So if I am here with my patient, I have to make a decision, and that decision may mean that this patient will get better or get worse.
Yeah.
And I do not have time to go and ask WHO or the government what to do. So that personal responsibility that it is between me and my patient, and what guidance I give is what is going to determine the outcome, is something that is very special in the medical practice. Where you have a disease that has been long-standing, say high blood pressure or diabetes or others, and a lot of papers have been published, and there is very clear guidelines as to how one would take care of that disease, then you would have come out of medical school knowing exactly what to do.
Yeah.
When you have a novel disease, something new that has just come, then you are back to what we call first principles. You must go back to the basic knowledge, work out what is from the first sciences, and come up with something that may be able to help your patient. And then you must look at people who are already in the front line, people who are working out there. What are they doing? What is it they have found out from their experiences? But then you must take personal responsibility for your decisions and what you do.
Yes.
Now, when you have a disease like that, this is an acute disease. All of us are learning on the job. So remember, I'm a gynecologist.
Yeah.
And now I'm talking about COVID.
Yeah.
Yeah. Now, if I was talking about, say, high blood pressure, I should be asked why I'm discussing that outside of pregnancy when there is a cardiologist who would be able to speak about it better.
Yes.
But this one, we are all in school. All of us are in grade 0. We are all learning is a new disease.
Yeah.
Everybody is learning on the job. Huh?
Yeah.
So you then must look at your patient. What do they have? What is new? What have you learned? Listen to what colleagues are saying and come up with something that is practical.
Yeah.
At that point, guidance from a world body is not useful at all. WHO cannot tell you what to do in an acute situation because things are evolving. They're evolving every day. Something new is coming up.
Yeah.
And world bodies would then need to digest this information for a year or two to be able to give standardized guidelines.
Yeah.
So in the acute phase, the person you go to listen to is a person who is seeing patients. What are other colleagues who are doing what I'm doing, are doing, and then you make your choices. So it was very strange. It was very strange to hear that WHO is telling us what not to do. And WHO is the one telling us what to do because it's very awkward. Yeah?
Wow. Yeah.
Yeah. So in an acute phase, a disease that is new, all of us are learning on the job. There is no specialist in this thing right now. All of us are learning on the job as we go. And you must listen to colleagues who have done something that is useful to remain practical to your patient.
So if I hear you correctly, you're saying that some of the regulatory bodies, the government, the WHO, the guidelines they're giving, sometimes restrict the doctors or could restrict the doctors in being able to give care to patients. That's what you're saying.
Well, what I'm saying is, in a crisis situation like this,
yes,
it is the doctor who is handling the patient who should be guiding the government and WHO on what to do, not the other way around.
Exactly.
Yes, I have a responsibility to my patient.
Yes.
This is what I'm seeing. This is what my colleagues are saying. This is what is working.
Yes.
We try what it is that they are saying and we see whether it will work for my patient. It is not for a world body to tell me what to do. It doesn't work that way. The world bodies, governments can give us standardized care for diseases like malaria and others that have been around for a long time, have been investigated and protocols developed, but not for something that has just happened and is affecting the whole world.
And everyone is learning at the same time.
Everybody is learning at the same time.
Thank you so much for that. Before, I'd like to move on and ask, some questions about the vaccine and maybe even just how, right now a lot of my friends are losing parents. And so maybe some thoughts on how we can care for our parents and the elderly. But I want to ask just a very specific question about treatment. So this is a Lenko protocol. How does the treatment work? So you're saying you take azithromycin. For how many days do you take it?
Okay. There's a Lenko protocol as far as the Kenya Catholic Doctors Association is concerned. We are really hoping we could use that for the pregnant women and breastfeeding mothers.
Okay.
Because they cannot take ivermectin, which is the other treatment.
Okay.
Now, the way the medicine works is that it is a zinc that prevents the multiplication of the virus inside the cell.
Okay, so
the zinc is the actual treatment.
So the zinc is the actual treatment. It prevents multiplication of the virus.
Yes, but unfortunately, the zinc would not be able to penetrate into the cell because it is a positive ion. So the hydrochloroquine helps to transport the zinc into the cell.
Okay.
So the first thing to understand is that they must be taken together.
So hydrochloroquine is a transporter. Zinc is the active.
Is the active one that is causing the virus not to multiply.
Okay.
The other thing about the treatment is that the window that you have for treating the patient is from the onset of symptoms. The first one is as the symptoms are developing.
Yes.
Because that's the point where the virus is really multiplying rapidly and increasing in numbers.
Okay.
And the higher the number of viruses you have in the body, the more likely you're to go into severe disease. So it must be taken immediately or soon after the development of the symptoms.
So now, are you saying there's a window in which this protocol then stops being effective if you're at a certain...
Yes. And in fact, it is very depressing, Amani, because you're saying if, one of the largest studies that was used to determine whether hydrochloroquine is useful or not, used hydrochloroquine only. They didn't give it together with the zinc. But even worse, they gave it to patients who are in ICU on ventilator support.
Oh, no.
Now, by that time, the virus has stopped multiplying because by the time you are doing 10 days from the time of symptoms, there is no more viral multiplication. And you see, when you do a study like that and say hydrochloroquine is not useful, you are actually misleading people.
Yeah.
Because the doctor who described it said you must use it with zinc and you must use it at the beginning of symptoms. That 1 week window is where you really need it.
Yes.
So that is again abuse of science, and it is very common. And that is the study that was used to say hydrochloroquine should not be used. And the people who used it totally ignored what the doctor who had said it is useful had done.
Yes.
And you can see mischief in this.
Yes.
So the hydrochloroquine must be given twice a day.
Okay.
For about 7 days. And then the zinc is depending on which formulation you have, it may either be, here in Kenya, most of them are coming in 20 milligram tablets. So 40 milligrams once a day. If you get a 25 milligram one, then it's 50 milligrams per day.
So you take 2 to make 40 or 2 to make 50? Yes.
Yeah. So but once a day, and then it's just for the 7 days. That's the time for the viral multiplication.
Yeah.
The azithromycin can be changed. You can use azithromycin or different
antibiotics.
Mm-hmm. But azithromycin is the easiest to use generally.
Yeah.
And even if it's taken for 10 days, it tends to cover for about 10. If it's taken for 3 days, it covers for about 10 days. And that one was really just being taken to prevent what we call secondary infection. Then because of the risk of
So just to get it clear, you take it maybe for 3 days, but it covers you for 10 days.
It covers you for 10 days.
Okay.
Mm-hmm. Now, to cover the risk of blood clots, which would usually come if you end up in phase 2 of the disease where the inflammation comes in, then it's good to start taking junior aspirin or low-dose aspirin. Just 1 tablet every day. Then added to this, then it's important to be doing your steaming at least twice a day. The steaming with just plain hot water. Cover your head over a little pot with some hot water. 10 breaths through the mouth, and you breathe out through the nose. That will take most of the heat into the lungs. And then you repeat another 10 with breathing in through the nose, out through the mouth, which then takes most of the heat in the sinuses. Just short breath. It just takes a very short time, 2 or 3 times a day. And you find that also reduces the inflammation in the chest. Now, that treatment has kept a lot of people out of hospital.
Including myself.
Including you, yes. And it is important that we preserve that for the pregnant woman. Now, for the general population, then you are saying, you use ivermectin. Hiyo dawa ilikuwa ya minyoo. Ivermectin 12 milligrams, and you take those at the beginning of your symptoms, and then in 5 days you repeat another dose. So in 5 to 7 days you repeat the second dose. Then you still do your steaming, you still do your junior aspirin. And you can add the azithromycin to prevent those. So, and then, of course, it's very important that for both protocols, you're also on vitamin D supplementation, because vitamin D is very important for the immune system function. And even though we're in the tropics, we are seeing people who have deficiency, because most of us are going into the office before the sun is up. And we go out when the sun is down. And when we're in the sun, we're in long-sleeved shirts, we're in full trousers. There's very little skin exposed to the sun, and that's what helps you to develop your vitamin D. And then Saturday has become a day of hustling. Sunday you want to rest. So we are finding adults in the tropics with actually vitamin D deficiency, which is very dangerous if you have COVID. So a supplement of vitamin D, depending on which one you have, there are those that 5,000 international units you must take every day. So 2 weeks, or there are those that 60,000 international units you take just once a week. For 2 weeks. And then there are those that are very high dose. You then find one single dose has 300,000 international units. We take that once, and it covers you for 2 months. So those would basically be the supportive treatment that one would need to be on. But that's the other one that we must remember to mention is that now during that time of treatment, you must closely monitor your oxygen levels. So the finger pulse oximeter is a gadget you can use at home. If you have country, you can share one in the village. The idea is if you check and you find the blood oxygen levels are dropping below 90, then it means the inflammatory process in your lungs has reached a critical level, and you would need oxygen supplementation. You need now to start using steroids. And at that point, most people would require admission for oxygen support and these other therapies. So these are things that are real. They are helping us. They are working, but they will not be said loudly by WHO. In fact, they will put a lot of papers to discredit them. They discredit anybody who says they work. They threaten you. The government is being advised by WHO operatives and WHO guidelines that seem to all be pushing us towards the vaccine. And they will not, we've shared this information with everybody we can. But in the end, it comes to each one of us to take a personal responsibility. If you have a relative who is sick, just put them on the treatment. You have nothing to lose. If you yourself are unwell, then put yourself on treatment, and let's avoid any further death.
You know, let me first say thank you very much for this information. And thank you for giving it to me at the day you did, because you literally saved my life, you know, and you ended up saving the life of my brother as well, who was unwell, who I took care of, you know. What you don't know is that my other brother just tested positive on Saturday, this last Saturday. But when he told me about his symptoms on Friday, I put him on the drugs immediately.
Very good.
By the time he was going to test, you know, and the doctor is asking him, you know, giving him advice on what drugs to take, the guy told the doctor, I started yesterday, you know. And
that is wonderful.
And to be honest, my you know, this second brother of mine, he's had much less symptoms than all of us.
He started his treatment early
because we caught it very early. And we started his treatment very early. So he's not even had full-blown symptoms. And I think he's on his 4th or 5th day now, you know.
That is amazing. It's very nice.
And so thank you so much for this information, because it's been life-saving for my family and for myself.
We thank God.
I want to talk about the elderly before we talk about the vaccine. And, you know, a lot of my friends have either, I know I have some friends who've lost parents.
Yes.
In the recent past, I'm talking about the last 2-3 weeks. Huh?
Oh dear.
And I have friends who have currently parents in hospital with COVID.
Yes.
One who was actually taken in 2 days ago. And I'm starting to see a certain dynamic, because, you know, our parents are, you know, they're also obviously vulnerable.
Yes.
And when they get sick, when they start coughing, they're stubborn, you know.
Yes.
And so what I'm hearing from my friends is that by the time they're taking their parents to hospital, you know, the parents are in a bad place. Not because maybe it was not preventable, or they could not have been treated early, but because you have stubborn parents, you know. And I'm wondering, as a doctor, one who has to give advice to many people, how do you help someone like me ensure that my parents stay safe, and if they get symptoms, that I have the language to be able to help them start taking treatment or get treatment?
Well, I think the best place for all of us to start is to re-emphasize the fact that COVID is real.
Yes.
There's been a lot of stories out there, or maybe it's not true, maybe it is this, you know. The thing is, COVID is real, and it is killing people. And the COVID is killing disproportionately. People who are over the age of 60, people who have comorbidities, are the highest fraction. Over 50% of the people who we are losing are in that category.
Yes.
Now, because they are not many, what we have proposed as the Catholic Doctors Association is, if we could get this information out there that treatment is available for the disease,
yes,
and we put all those parents of ours who are at risk on ivermectin, just 12 milligrams once a week for a month, because that will protect them for another 8 weeks. What it means is that we have a 3-month window within which we can fight this virus very aggressively. And by June, July, we can make sure that it is gone from our country.
So you're saying, so just hold on, that's very important, because you're saying that right now I can put my dad on ivermectin.
Yes.
He's not unwell. He's not showing any symptoms.
Yes.
But if I put him on ivermectin 12 mg for once a week
for 4 weeks,
for 4 weeks, I'm giving him protection.
Yes.
For another 8 weeks.
Yes, you protect him. So if he takes it for a month, he's protected another 2 months.
Wow.
Now, what we are saying is this medicine, because it is working both as treatment and prevention, for the old and the vulnerable, let us not wait for them to get sick. The minute we allowed the children to go back to school and the children came back, they're getting very mild symptoms, but they're bringing the virus home.
Yeah.
And now, especially when we locked down at the height of the disease in Nairobi and closed jobs, what happened is that we took a very big dose of this infection up country. So it would not be surprising that in another month or so, there would be all the other counties will now start having very high rates of COVID. So it means our parents are now extremely vulnerable.
Yeah.
So it's important because they have buried their own and they have they know relatives who have died. It is not difficult to convince them that there is a problem. And then to tell them that instead of the vaccine, the treatment, the prevention works even better. Okay, so we put them on the ivermectin all over the country. Any person who is over the age of 60, anybody who has those diseases, diabetes, hypertension, anything, HIV, whether you are 60 or not, we put them on the ivermectin treatment prevention protocol. Then we tell everybody who develops symptoms of COVID to actually go have a test done and start on treatment even before the results come out.
Yeah.
Because even if your test is negative and you have symptoms, we are missing up to 30% of people because there is a false negative rate of up to 30%.
Wow.
Okay?
Yeah.
So whether the test is positive or not, so long as you have symptoms, start taking the medication. Then we tell everybody who is unwell to make sure they check their oxygen levels. In 2 or 3 months, we can actually be done with this disease. That is what we believe.
Wow.
Now, remember the vaccination exercise, the 1 million doses will only cover less than 10% of the country. Is what actually 0. Some?
10% is at 5 million. So 1 million is at 0 point something, 0.1 or 2 point.
0.5%. Yeah. And that is phase 1.
Yeah.
It is a drop in the ocean. And we are saying we'll finish the vaccination would be projected to finish maybe 2023.
Yeah.
Who wants to wear a mask until 2023?
Yeah.
The alternative is we put the vulnerable on preventive care, and anybody who develops early symptoms, we start them on treatment early. And the people who are on treatment monitor their oxygen levels. And if it goes below 90, then we go for oxygen support.
Yeah.
What would happen is that we estimate in the next 2 or 3 months, we basically would be out of the woods.
Wow.
Yeah.
That's such useful information. Thank you so much for it. And I'm gonna put my dad and mom on ivermectin today. You know,
it's very important
based on this information. Now, let's talk about the vaccine. Okay.
Yes.
So we have a disease that is preventable. We have a disease at least that is treatable.
Curable.
It's curable.
Let's say it's treatable because it's still a new disease.
Yes.
There's still a lot to learn.
Okay. So we can treat it. Huh?
Yes.
And there's all this, we're not talking about the treatment in public. So there's the emphasis on the vaccine. And then there's all these different types of vaccines that we are hearing about. And, we are hearing conversations about different efficacies. So my question is, what are your thoughts on the vaccine? Should we be rushing to get the vaccine? How much protection are we getting? What type of vaccine are we getting? Are we on Johnson & Johnson, AstraZeneca, sijui Sputnik? What's the efficacy? It's a lot of confused information for me, who is just a normal civilian.
Yes.
Where can we get some sort of clarity?
Well, the thing is that medicine and science are basically very rational. Science is very rational. And it's very logical.
Yes.
And anytime you're caught up with new information, the best thing to do is to fall back to what we call first principles. Just go back to the basics. And that's what we do at the Catholic Doctors Association. So a new vaccine has come. We ask ourselves various questions. And the first question you ask is whether the vaccine is necessary. Okay? If you find that the vaccine is necessary, then you ask the second question is whether it is efficacious. Does it actually work? And if it works, then you ask the third question, is it safe? And if you find it is safe, then you go to the last one and you ask, is it cost effective? Okay, so compared to whatever else that is available, is it cost effective? So a very logical system, very clear. It helps you not to make unnecessary decisions, especially based on passion or fear.
Yes.
Now, when you look at the vaccines for COVID-19, first you understand from a scientific perspective that vaccines have never been used before for a pandemic. You know, a pandemic is just an epidemic. It means it's a new outbreak of disease, but it is affecting a wide geographical location. So it really is just an epidemic. It's an acute, something very new that has happened. Now, most acute diseases like the Spanish flu, in 1 or 2 years, it will burn out naturally because people will develop immunity, and those who will die, and unfortunately, eventually the disease will be defeated by the immune system. And it doesn't matter whether this disease has ever been present in the human population before or not. That's just how nature works. But then if we just sit back and allow people to die, then again, it is not very nice, isn't it? So the first thing we say in an epidemic is that it will probably have burnt down or burnt out before you have developed any vaccine and seen its value. Okay, so that's naturally what happens. So what you do is you put in contingency measures, you put in measures to reduce this risk of death. And that's where we are aiming to flatten the curve. Yes. So mask, social distancing, wash your hands. And now we are adding go early for treatment if you develop symptoms. Yes. And we'll basically be able to defeat this disease. Now, if the acute phase or the epidemic phase passes, and you find we have gone in what is called the endemic phase, this disease now is just hanging around. It is not quite going away. It keeps infecting people. People are dying, but, there is already herd immunity, but people are still getting sick. Then now you can now talk about a vaccine to try and eradicate this disease. Okay, so vaccines were always for the second phase of managing the disease when it is endemic, like smallpox, not in the acute phase. So that's the first surprising thing. So if COVID is already dying down, it means if with measures put in place in another 1 year, naturally then it will be over this thing until another virus comes. So that's the first one. We've never used vaccines to take care of an epidemic or a pandemic. Okay, it takes long to develop them. It's expensive. By the time you do safety studies, the disease is already dying down. But then for COVID, we are told because it was killing very many people, it is causing a lot of deaths and destruction. And now we are closing down, the economy is suffering. Then the idea was let's approve vaccines for emergency use. Okay, so all the vaccines currently are allowed for emergency use only because their safety has been studied for a very short period of time. Now, the sad thing is that most of these studies that have shown efficacy of the virus, of the vaccine, and the safety of the vaccine are hardly published. So they are not available to the average doctor. So I cannot tell you whether the vaccine is safe or not because the safety studies that are supposed to be available to me, that are supposed to be public knowledge and published, are not available. And this is because the vaccine has been allowed only for emergency use.
Yeah.
Okay, so that's the other thing. So we don't have the studies available to us, but then we are told it is killing very many people. Now, when you take how many patients we lost in this country over the last 1 year, by the end of December, it was about 1,800 people. It's very unfortunate. These are not statistics. They are not numbers. They are human beings. They are our relatives.
Yes.
But if you compare that to the 53 million Kenyans, you find that the risk of dying from COVID in this country, from a statistical point of view, is 0.037%. And this is without intervention. This is without giving anybody treatment. Now, when you compare this then with the number of deaths that we lost in 2019 in road accidents, there are over 3,000, you find your risk of dying from road accidents is twice that of dying from COVID. If you compare this to malaria, you find it is 6 times. The risk of dying from malaria is 6 times more than from COVID. And if you compare to HIV, it's about 13 times more. Okay? So on a scale where you're saying this is a very serious disease and it needs to be taken very seriously and we need to do a lot of things to prevent it, then you are saying that on that scale, in this country, there are many other problems. There are many other problems that are killing people other than COVID. But so if you were to look at it, say, from an emergency point of view, for this country, it doesn't qualify. Okay? It doesn't qualify to be allowed to use on experimental basis based on the number of deaths that we have experienced.
Allow me to push back a little, Daktari.
Yes.
Because, I agree with you on the statistics for last year.
Yes.
But this year seems a little different. And it feels a little different, even to me. In the last 3 weeks, I've lost 5 friends. To COVID. My friends, mine. People I can name that I had a personal relationship with, and I've lost them to COVID. And like I've mentioned to you, I have a couple of friends who've lost their parents to COVID as well in this last maybe 3-4 weeks. So it's starting to feel that maybe there's an escalation. From last year's statistics, and I'm wondering, is that escalation, does it qualify for an emergency?
The escalation is twofold, and it is good to then look at it. The idea is that if you remember, children never went back to school the whole time we had locked down.
Yes.
Now this may have been an accident because most other places were allowing the children to go to school because they were having very mild infections.
Yes.
But by God's grace, Kenya kept the children home. And what this has done is it helped us a lot because only the people who had to leave home to go and fend for a living were exposed.
Yes.
Okay, so we had half the population that managed to stay at home, and especially here in Nairobi, and avoid being infected. Once we allowed the children to go back to school, what happened is that the children they shared the virus and came home with it to the people who had not gone to work. And now we started getting the other 50% of people who are at home now start to get the infection. Okay.
In fact, I got mine from my daughter, and that's how I got it. Their mother got it, and my brother got it as well. So the 3 of us, we all interacted with her at the same time. So I agree with you.
Yes. So this is what happened, and the other thing is that Camry had already told us this is going to happen when the schools were open. They told us in March, basically, this is going to happen. Now, remember that all this is happening without us saying that there is effective treatment. And you can imagine what difference it would have made because we had already learned so much about the disease over the last 8 months or so. It would have been so easy to take care of this because it was projected by the scientists and we were expecting it. Of course, it didn't help that It didn't help that the politicians were being a bit careless and having all these
political rallies and
rallies and things,
and some bars opening and people going to drink.
And then of course the new variants. There would be some variants that would come probably that were more aggressive, and that would make the spread. So the new variants are spreading much faster, but they are less aggressive in terms of causing disease. Therefore, you could get more people infected. So, of course, all this played up to give us this spike that we are currently seeing. But you see, in the end, other than because we are personal and we can tell who has been involved, if you look at the overall figures, you will realize that the disease from a scientific point of view is not as severe as even the other things that we have in the country. Now, the other area that would be very important is to understand that we now then go to ask ourselves, is the vaccine necessary? And you find that considering the risks that are there statistically, then the best thing to do with this disease to get rid of it is to treat the population. Okay? So 10% of the people are the ones who are at risk of getting the symptoms. Okay? That would give you about 5 million people in Kenya, assuming everything is held constant. Half of this population is below 24 years old. That gives you 2.5 million people who may be at slightly greater risk. And then by December last year, Kemri had already estimated 50% of the people will already have contracted the disease and developed herd immunity. You cut that down, and what you end up is with about 1.25 million people at risk. Okay? Even if all these people got sick, Maranga, and you multiply this by 5,000 shillings, which is what the average cost treatment is coming to, taken from a high-end hospital, then you're saying we look at 6.25B as the amount of money you need to put everybody who is at risk on treatment. Okay? Now, the first phase of vaccination is to cost the country 34 billion. Okay? And this is just to take care of the high risk, the people who are the doctors, the people in the military and all that. 34 billion. And of this, the government is supposed to put in 14 billion. Bill Gates is to give about 20 billion to Gavi. So you're saying half of what the government would have spent on vaccine is sufficient for us to put our people on treatment because there is treatment that is effective. So when you look at the cost effectiveness and the availability of what it is that you want, because the vaccines are just 1 million and we have 53 million of us, and Europe and everybody else is going to vaccinate themselves first before they give us the vaccine. The idea is that with just taking the treatment and the preventive measures that we have said for the old people, we actually would not need to roll out any vaccination in the country. So it is from this kind of analysis that you would then say it is not necessary. Now, whether it is effective or safe then becomes redundant. You see, so we are not even bad-mouthing the vaccine. We are not bothering to say it is killing people, it has blood clots, it has all those things. We are not bothered. All we are saying is, given our state of the economy and given the knowledge we have of this disease and given the fact that there is effective treatment, we actually don't need to vaccinate anyone. The other thing that you must keep in mind is that when you vaccinate, then remember you're giving the vaccine to a normal population, people who are completely healthy and well, okay, in order to protect those who may get sick from the disease. So if you vaccinate 53 million Kenyans, okay, and you vaccinate all of them against this disease, and you find that the risk of side effects is only 1%, then you're saying 500,000 people are going to get the side effects of the vaccine that you will give. 500,000 people are going to get side effects, okay? But in 1 year, we have lost less than 2,000 people. So if you look at that mathematics, what would be better to do? Is it better to risk the whole population having side effects of a vaccine, even if it is mild? Or is it better to treat those who are already sick and not interfere with the healthy, who are getting immune from the virus without having to use a vaccine? The other thing to take into consideration is that the vaccine, for instance, the one that is here, you're taking a virus from a monkey that is called an adenovirus, okay? And then you're putting into this monkey virus the genetic material of SARS-CoV-2 that is creating the spike protein, okay? So what you do is you create a genetically modified virus that is the monkey virus, but now it is showing the spikes of SARS-CoV-2.
Yeah.
Two things here that are very important. Number one, it is me, the scientist, who has decided which part of the virus I will use to produce antibodies. I have chosen the spike protein.
Yeah.
Okay?
Yes.
And it is the only one I have given you to make your antibodies.
Yeah, I've given you only one option.
Only one option,
Yeah.
and it is me who's chosen it based on whatever criteria.
Yes.
Okay?
Yeah.
Then you have somebody who has gotten natural infection. The person who gets a natural infection gets the whole virus, and it is the immune system that decides which part of that virus to form antibodies against. So what happens then is that anybody who gets natural infection always gets better protection than the person who gets the vaccine. So anybody who has gotten sick and recovered is currently our hero. He or she is telling us we can overcome, we can actually do this, and we can get over it. And the vaccine will not give you more superior protection than natural infection.
Oh, wow.
It is very important for Kenyans to understand that the vaccination immunity is always less protective than natural disease, because the vaccinated person was only given a portion of the virus, whereas the person who acquired natural infection has been given the whole virus. The other thing that is very important is that the natural disease goes through the natural system. You breathe it in through the respiratory system. You first develop what is called the cellular immunity, and it is the cellular immunity that trains the cells that will form the antibodies. That is how the natural system works. Always start with cellular immunity, then come and develop antibodies later. The antibodies are very short-lived, 2-3 months, they are gone. Cellular immunity remains active for many, many, many years.
Yeah.
Now, when we give you the vaccine, now we inject you into the muscle, which means we overlook the cellular immunity. We overlook the natural first barrier, which is where your cellular immunity develops from.
Yeah.
So generally, anybody who has had a natural infection has better immunity than somebody who has been given the vaccine. And again, that is something that's very important to remember.
Wow.
One other thing about the vaccine that is very important for people to understand, it is the person who refuses the vaccine that is at risk, isn't it?
Yes.
So assume the vaccine works and you get it, Amani. Why would you be scared about me who hasn't taken the vaccine? Because technically you're protected.
Yes. I have a bulletproof vest.
Yes, and I am the one who is exposed.
Yeah.
So when you hear scientists saying that the people who are refusing vaccination are exposing the others, then you know that that statement is incorrect. It is not true. It is the person who is vaccinated should ideally be protected. But we have just understood that the person who got natural disease is better off than the person who is vaccinated.
Yeah.
Then remember, they have already told us that the vaccine will not stop you from getting infected, and it will not stop you from transmitting the disease if you get it.
Yeah.
So what they are saying is that despite your vaccine, you may still get the disease.
Yeah.
Okay?
Yeah.
So why not just treat those who are infected? You understand? because with treatment we can still reduce the risk of death and we can still reduce the risk of severe disease, which is the only advantage that the vaccine was supposed to give us. And then finally, if this vaccine, because for instance, you remember the human papilloma virus vaccine that was being said to help to prevent cancer in little girls, and we were to inject it to little girls over the age of 10 or 10 years and about.
Yes.
And again, the Kenya Catholic Doctors Association said this vaccination is unnecessary because this is a sexually transmitted disease. Okay? And the idea is that the vaccination will probably protect the children for about 10 years. So by the time your girl is 20 years, and when they really need the vaccine is no longer useful. But the fact that we analyzed it and found it was not necessary. Only 0.1% of the people with HPV are not able to clear it out of their system. 99.9% clear it out of their system using natural immunity without you helping them at all. And this 0.1% who can develop cancer, then if you do a pap smear every 3 years, then you detect changes that would lead to cancer 8 to 10 years before the cancer has developed.
Yeah.
And Europe and America reduced the death from cancer of the cervix by just doing regular pap smears every 3 years. Okay?
Wow.
So we analyze this and we say it is not necessary to vaccinate our virgin children, isn't it?
Yeah.
Now, today, information is coming out that some of these children in Australia, Europe, and other places who are vaccinated against HPV, 5-10 years later are developing premature menopause. Okay?
Oh, wow.
Now, remember that the studies that checked for safety of the HPV vaccine were run for 6 to 8 weeks. Then you discover 5 or 6 or 10 years later, you have other things that you never found out that are becoming clear now.
Yeah.
Okay? Now imagine you have vaccinated the whole population of Kenya with 53 million people. You have vaccinated them against COVID. And then 10 years later, we discover there was something wrong that we hadn't known. You're saying you can destroy a whole country. You can destroy a whole generation. You can destroy the whole military force. You can destroy all your health workers. It is not an easy decision to make, to vaccinate the whole population. And it is not a good decision to make where your disease is treatable.
Hey. I don't know how to deal with this information because now I'm asking myself, so on one hand, I feel like Superman because, I mean, you've basically told me my immunity right now is better than that of someone who's been vaccinated.
True.
And on the other hand, I know that maybe if I wanted to hop onto an aircraft tomorrow to go to another country, they might require me not to get a negative test, but to show that I have been immunized.
That is true, Amani, and it is very important that it has come out clearly.
Yes.
The reason why you are to get the vaccination passport or the health passport
yes.
is the reason why we have this crisis. You see, it is from the time we started with HIV/AIDS. You remember HIV/AIDS?
Yes, I do.
And we were told that even if your spouse is positive, yes, and I know that your spouse is positive, I cannot tell you because I'll be destroying my patient-doctor relationship with that patient.
Yes.
And that I can actually be sued by a spouse
yes.
because I have disclosed their HIV status to their partner without their permission.
Consent. Yeah.
So the issues about medical health and the issues about vaccines and the issues about the treatments that you're receiving has been something that has been protected by the Geneva Protocol of Human Rights. That even if it is HIV, I cannot tell your partner, even though I know that you can transmit it to them.
Yeah.
Now, where we are being taken is where now you will be walking around with a badge saying how many vaccines you have been given in order to be allowed to access services like air transport.
Yeah.
That Maranga has nothing to do with COVID. It has to do with control of populations. And people need to open their eyes and see that COVID is being used as an excuse to introduce medical health as a control measure before you can access goods and services. The day we surrender that as humanity, it is the end of our autonomy as we know it today. I don't know how many people can see that danger, but it is very clear in my eyes that if I have to give a passport or something or some document before I can enter into a restaurant, before I can go somewhere, that is based on the medicine I've agreed for them to inject into my body, then I have just opened a Pandora's box that every year another SARS will be created, and every year another vaccine will be created, and somebody is going to make money from that cycle of illness and vaccination, illness and vaccination. And if I put something that is not good in that vaccine, then I can actually destroy a specific area of the community, depending on who I vaccinate and with what I vaccinate them with. We are going into some very, very dangerous area, and that has nothing to do with medicine. So remember, all along we had discussed COVID-19 and how to manage it and how to go back to normal.
Yeah.
The minute you start saying, I cannot do certain things unless I have a health passport, then now I have introduced a new form of slavery. That is a totally different agenda, and it is made nonsense of by the fact that we have treatment. Today, a person who is vaccinated can actually generate a vaccine certificate from their system. You can get one on email. Okay?
Yeah.
So today, CDC in the US is already developing criteria of how those who have been vaccinated can start to go back to normal. If you can't see this picture of control, of somebody taking away your independence, that it is now somebody or a state or an organization, a private organization that will say who will access what service, then I fear that you're totally blind.
I don't even know if I should follow that train of conversation anymore, because it's such a Pandora's box. Yeah.
In fact, I would also rather not follow it, but it opens up the mind of anybody who wants to ask questions.
Yeah.
Why would you be fighting with simple doctors who just want to do their work to prevent death and to help their patients get better by telling them not to do exactly what they know what to do? For instance, WHO says, I give you Panadol and I send you home and I ask you to come back when you have developed difficulty in breathing. All right?
For COVID, yes.
I know there is medicine that can reduce your viral load, and I know if I don't reduce your viral load, your risk of going into severe disease and critical illness is very high.
Yeah.
But the advice of WHO is I don't give you treatment. Now, we know that your difficulty in breathing will develop after your oxygen levels have been low for a very long time.
Yeah.
So if I don't tell you, even while on treatment, to monitor your oxygen levels, then I am actually putting you at very great risk. So if I do what WHO has told me to do, take these painkillers, take these vitamin this and that, go home and come back if you have difficulty in breathing, what I have given you is a prescription for death. And I know this as a doctor. And I choose to do what my training has taught me to do, to put you on treatment and to tell you to use an oxygen meter. And if you have difficulties, you come. If your levels go down, you come.
You come immediately.
I am practicing medicine. What WHO is asking me to do is witchcraft. Is a recipe for disaster. Now, I don't really care why they are doing it, but it will be completely absurd for me to follow that instruction. I should never have gone to school if I was to agree with them. Now, they are promoting the use of vaccines in the middle of a pandemic, and the vaccines should not be used unless your disease is an endemic. It doesn't make sense. Again, it doesn't make any scientific sense. It doesn't make any logical sense at all. And especially where treatment is available. What we should do is treat this disease, prevent the old people from getting the disease, and in 2 or 3 months we are back to normal, and we don't need vaccine certificates, we don't need vaccine passports, we don't need all those things. So unless there is an agenda beyond the disease, that if people continue dying, they are likely to line for the vaccine. And if they line for the vaccine, they must get a vaccine certificate. And at the end of this crisis, we have established a world order where you cannot move around unless you have a vaccine certificate. None of these instructions make sense at all. So for me as a simple doctor, I would rather not take my mind there. Leave me alone to treat my patients the best way I know how. Don't interfere with them. Don't make the medicines I'm using disappear. And then let us wait and see who between the two of us who have done the right thing.
Wow. This is so much information, but I am so grateful that we have, courage like yours to speak truth to power, to guide us, give us clarity. I remember you telling me that some of the people who got SARS, 10, 13 years ago are not getting COVID. They were able
getting COVID. Yes, there is cross immunity.
There's cross immunity, and they're able to withstand. I guess it's what you were trying to explain, that cellular level of immunity.
Yes. There is another thing that maybe just to clarify for those who are considering the vaccine.
Yes.
The idea is, if you understand that natural infection has given you a superior protection than anybody who is receiving a vaccine, then what you will understand is that anybody who has been sick, who has developed this disease, doesn't need to be vaccinated. And because the person who has been vaccinated has only received one portion of the virus that has been chosen by a scientist in the laboratory. And this vaccine will not stop them from infection and will not stop them from spreading the disease. My advice is, even if you know you haven't suffered from this disease and you have gone and taken that vaccine and you develop symptoms for COVID, for goodness sake, take the medicine and take it even quicker than the person who had not been vaccinated. Because the assumption that you're protected may make you delay taking the treatment.
The treatment, yes.
Yes. Then finally, it is the person, if you have been vaccinated, ideally, you should be the one who is protected. So if I choose not to take the vaccine, I cannot threaten you. Do you understand that?
I'm not putting you at risk because you're the one who has the protection.
Yes, because there is a lot of issues out there that it is now my moral duty to be vaccinated so that I can protect the others. That is total rubbish. It is the if indeed the vaccine is working, the guys who are vaccinated should throw away their masks and walk around without any masks, because they should be protected compared to those who have not yet received the vaccine.
But we know that the vaccine, doesn't protect you from infection.
Yes, it doesn't. So why take the vaccine in the first place? We are in the same boat. In the end. So the thing is, if we were to use logic and not use commercial interest and not use power play and just be doctors and take care of patients, all we would have done is 1 month we go around telling people about the value of the treatment, how it is taken, who should take it, the value of preventive care for the old people, keep our masks on for the next 2 or 3 months. Those figures will start coming down on their own. And once they go down to zero, we can start relaxing everything. So that by June, July, we are hugging again, we are shaking hands, we don't have our masks, and life goes back to normal. But the person who is telling us we will not go back to normal ever, that we all must be vaccinated, And even after that, we must have a passport for us to access services. That person has something that they need to tell us. There is something they know that is not clear to everybody else.
Dr. Wahome, Uncle Wahome, thank you for your time. Thank you for the information that you've shared. I don't want to add anything to it, but I want to say thank you. I want to say thank you for several things. One, thank you for taking care of me.
You're welcome.
You saved my life, and I owe you for that. And in turn, you've allowed me this knowledge that you gave me while I was unwell. I have shared it with a lot of people who have contracted the disease. I've shared it with my brothers, and I can testify that I'm better for sure. And you spoke to me when I was unwell, so you know the state I was in.
Yeah. Mm-hmm.
I'm better. My brothers are better. And if I needed any evidence of what you've said, then I have the evidence because I've experienced it myself. So I want to thank you for that. Thank you so much for taking care of us. Thank you for this information as well. Thank you for the courage to speak truth to power, for sharing information that I can testify is working, and that your work, you and your fellow doctors, the people in the association of the Catholic Doctors Association, and people who are believers like you, who have gone out of their way to make sure that the progressive doctors that have gone out of their way to make sure that the population gets treatment. We thank you. And lastly, I want to thank you for taking your time to speak to me, being on this podcast and sharing the knowledge with me. I am completely grateful for it. Thank you so much, sir.
Thank you very much. Just a parting shot. We have always been told to be very clear as doctors that we treat it is God who heals. Because you can put two people on the same treatment, one makes it, one doesn't.
Yes.
So that credit goes to the Almighty God. And the other one is basically that there is hope and it is doable. We can defeat this disease. But then we must use channels such as this. People should share this information because we don't have the capacity that we would have had if we could go to national radio and national TV, address people, tell them what we know. So share this information. Let us save lives. I really don't care who makes profit or who doesn't. So long as we can save lives, then my work is done.
I agree with you completely. And so if you're a listener of this podcast, you know what to do with this particular episode. Share. Let people get this information. Let them learn. Let them hear the right thing. And listen, put your parents on ivermectin 12 mg right now, once a week for 4 weeks. Do it. Do not waste time. Do not gamble. I've seen too much loss for this to make sense. So do it. Dr. Ngare, thank you very much. God bless you. Thank you for your time.
Thank you very much for the opportunity.
Yes, and I look forward to seeing you very soon. Asante sana.
Thanks. Okay.